Om Swastiastu. My name is Maria Prameswara Avananda. With student number 102 from SGD B7, will be presenting our paper with the title of Sudden Deafness in Meningitis caused by Streptococcus suis. These are the members of our group. Streptococcus suis, especially serotype 2 or SS2, can be transmitted through cutaneous contact with infected pig, especially when the skin has cuts or abrasion, or consumption of raw pork. Infection of Streptococcus suis may manifest into many diseases such as meningitis, which then lead to sensorineural hearing loss or HNHL, sepsis, arthritis, infective endocarditis, endophthalmitis, and spondylolisthesis. Sensorineural hearing loss occurs when there's a fault in the inner ear caused by infection of Streptococcus suis meningitis or inflammation of the auditory nerve that carries sound signal to the brain, which cause vestibular dysfunction, with incidence prevalence 31.6% up to 53%.
Hello, doctors and friends. My name is Anish Sharma with three name last digits 251, and I'll be explaining from the writer's concern till the benefits. So, for writer's concern, the red larva, which contains minced pork mixed with raw pork blood and vegetables, and the como soup, which contains fresh pork blood and Balinese herbs. The mebat, which is a part of a Hindu ceremony, it includes slaughtering of pigs, cutting the pork, cooking it, and serving it as dish termed as red lava and como soup. It includes consumption of raw pork products, especially undercooked pork blood, which is a strong risk factor for the transmission of Streptococcus suis infection. The main concern is to increase knowledge and awareness of sudden deafness, which is caused by Streptococcus suis meningitis infection, in order to provide a better medical service. The research questions includes what is the definition, how is the epidemiology, what are the etiologies and risk factors, the pathogenesis, what is the diagnosis and differential diagnosis, what is the treatment, what is the prognosis and complication, and also what is the prevention of sudden deafness in meningitis caused by Streptococcus suis. For purposes, the purpose is to study what is the definition of sudden deafness in meningitis caused by Streptococcus suis, to study the epidemiology, the etiologies, risk factors, pathogenesis, diagnosis and differential diagnosis, treatment, prognosis and complication, and lastly, the prevention of sudden deafness in meningitis caused by Streptococcus suis. For the benefits, there are three benefits: scientific benefits, clinical benefits, and social benefits. In scientific benefits, this paper is to improve the knowledge and deepen understanding about sudden deafness in meningitis caused by the Streptococcus suis, as it can be used in scientific studies, especially in the field of neurodegenerative dermatovenereology and ENT diseases, and also can be used as a reference in the further research. In clinical benefits, this paper can be used by the next researchers as a supporting theory and reference in order to increase knowledge and solve the problems related to sudden deafness in meningitis caused by Streptococcus suis infection, in order to provide a better medical service and also to prevent permanent disability of the patient. Lastly, for social benefit, this study are expected to increase public awareness in order to minimize risk factors which can cause sudden deafness due to Streptococcus suis meningitis, and also to reduce mortality rate of the Streptococcus suis infection, especially for Balinese people with a culture of consuming pork with minimum processing. That is all from me. Thank you for listening. The next part will be presented by one of our SGD members.
Good morning, teachers and friends. My name is Sarah with 3-digit number 073. Now I'm going to talk about definition. So, Streptococcus suis is a gram-positive ovoid or coccus bacterium with a polysaccharide capsule that is facultatively anaerobic. It is a commensal, and the pathogen's natural habitat is in the pig's body, such as the upper respiratory tract, the genital tract, and the alimentary tract. So the most common symptoms are acute meningitis or arthritis, but pneumonia, endophthalmitis, endocarditis are also possible. And the most common complication is the sensorineural hearing loss that develops during the acute stage of meningitis. and it should be considered as a cause of bacterial meningitis for patients who consumes undercooked pig products.
Hello doctor, hello my friend, my name is Naswa, student number 135. So I'd like to explain about the epidemiology of the Streptococcus suis. So, in the world there are approximately 1,500 cases, which is commonly happen in Southeast Asia where there are a high population of pig. As we know that Streptococcus suis is an zoonosis disease. In Indonesia itself, Streptococcus suis is mostly found in Bali, where a high consumption of pig. The prognosis of the disease is also severe, where the patient might develop a meningitis, which occurs in 68% of the infected patients, while as an HL or sensorineural hearing loss happen in 50% of the patient with the meningitis. You can go to the next slide.
Thank you for the time. My name is Joshua Imantoro with the last 3-digit NIM number 035. The etiology of sudden deafness can be caused by several risk factors, including vascular disturbance, viral infections, and meningitis suis. In terms of vascular disturbance, diabetes mellitus is known to be one of the most prominent risk factors for sudden deafness. It is suggested that diabetes mellitus causes microvascular lesions in the cochlear compartments that may be the origin of sudden deafness. Aside from diabetes mellitus, another vascular disturbance that may contribute to sudden deafness is hematological problem, including hemorrhage. Hemorrhage causes blood migration into the perilymphatic space in the cochlear compartment. Next, the majority of sudden deafness caused by viral infection happen in pediatric population, and most of them are caused by mumps virus. Lastly, sudden deafness can also be found as a common complication in meningitis patients infected by Streptococcus suis, or in other words, sudden deafness by meningitis suis. There are several risk factors that further enhances the risk of sudden infection in people with meningitis suis, including male, old age, diabetes mellitus, hypertension, smoking, kidney diseases, anemia, and dyslipidemia. Though, through the analysis, it was found that there are two risk factors that serve as a protective factor of sudden deafness, including alcohol consumption and cardiovascular events.
Good morning, doctor and friends. My name is Aimila Anawati Santoso, number 007. I will present about the pathogenesis of sudden deafness in meningitis caused by Streptococcus suis. The pathogenesis of sudden deafness in meningitis caused by Streptococcus suis is not well known because the cases is rare. But some of case reports say that sudden deafness in meningitis caused by Streptococcus suis is caused by complication of meningitis that damage a cranial nerve. Not many information about how Streptococcus suis infects the host and crosses blood-brain barrier, but there is a case report found Streptococcus suis in CSF 66.7%, in blood 50%, and both of CSF and blood in 25%. Some hypotheses about Streptococcus suis that make meningitis are bacterial invaders from mucosal infection to bloodstream, survival bacteria and blood, and invasion bacterial from blood to central nervous system. Early hearing impairment and vestibular dysfunction is related in Streptococcus suis meningitis.
My name is Kizzy Gavrila, student number 160. Today I'm going to explain about diagnosis. Early detection of Suis and meningitis is crucial in preventing the development of hearing loss in meningitis. And then Suis as an HL is poorly diagnosed because patients do not undergo audiometry screening until they have complaint of severe hearing disorder. In a diagnosis attempt, firstly we would do a physical exam, which then to look for inflammation, fluid or earwax buildup, damage to the eardrums, and foreign bodies inside the ear. CT or MRI scans may show swelling or inflammation of the head. The main exam is based on culture results from cerebrospinal fluid or CSF and or the blood. In people with meningitis, the CSF often shows a low sugar or glucose level along with an increase in white blood cell count and increased protein level. And then the next one is an audiogram test using audiometry used to diagnose and monitor the degree of hearing ability. During the test, the patient will wear headphones in a soundproof booth. Sounds and words are played in each ear at different volume and frequency. The test helps to find the softest sounds that can be heard and the specific frequency of hearing loss. Repeated audiometry is only performed for those who show hearing loss at the first test. Thank you.
Streptococcus suis infection should be considered a differential diagnosis in cases of meningitis that present with early hearing loss. It is also imperative to understand the factors that lead to zoonosis, possible community spread, and disease progression of Streptococcus suis infection in order to reduce the morbidity and mortality associated with Streptococcus suis. The general population at risk should be sensitized to correct handling of swine and pork products. Thank you.
My name is Koma Anjani Putri, number 031. Treatment of sudden deafness in meningitis caused by Streptococcus suis. Immediate therapy given to bacterial meningitis is with antibiotics. After the patient was confirmed to have meningitis due to Suis infection, treatment was continued with penicillin G, accompanied by one or more other antibiotics, including ceftriaxone, gentamicin, chloramphenicol, and ampicillin. Penicillin G is given 24 million units over 24 hours for at least 10 days, or ceftriaxone is given 2 grams every 12 hours for at least 10 days. Quick diagnosis and early antibiotic treatment are the most important factor in reducing the damage caused by Suis infection. Deafness experienced by patients due to meningitis Suis should immediately receive hearing and vestibular rehabilitation to increase their independence in daily activity. Dexamethasone has been shown to reduce mortality in pneumococcal bacterial meningitis and reduce hearing loss and neurological sequelae in all cases of bacterial meningitis. Dexamethasone treatment in area with high level of Suis as a cause of meningitis could potentially reduce the very high rate of post-meningitis hearing loss.
My name is Code Estrapete Pamayun with student number 252. The reported case fatality rates associated with Streptococcus suis meningitis vary among countries. One study reported a rate of 2.9%. Another study reported that 70% of confirmed cases recovered without any complication, and the case fatality rate was 11%. An outbreak of Streptococcus suis in Chengdu was associated with an overall case fatality rate of 6.67%. The mortality rate has generally been low, but many recovered patients show some form of sequelae. Hearing loss is the most common sequelae that occurs in 53% of the patients. Antibiotic and corticosteroid administration have shown good results and have been implemented in many centers. Streptococcus suis can cause various complications depending on the organs affected, such as permanent deafness, arthritis, encephalitis, and etc. Under improper treatment or in immunocompromised patients, the infection may develop into systemic illness such as multi-organ failure, DIC, sepsis, and septic shock. One study in Bali reported that 11% of the patients experienced septic shocks and 2% suffer from deafness and arthritis. Patients with Streptococcus suis infection must be under close observation, and care has to be focused on improving host immune system, reducing infection burden, determining the starting point for antibiotic administration, duration of treatment, and further sign monitoring. Relapse rate of Streptococcus suis is low and usually can be successfully treated with continuation of penicillin or combination therapy. Thank you. Next.
Thank you for the opportunity. My name is Igor Kinjro with last 3 digits of my serial number is 119. Now I'm going to talk about the prevention. Currently, the most promising option we've got to prevent the Streptococcus suis infections is by improving and or developing better vaccination strategies. Autogenous vaccines are the only vaccine available that swine producers have access to. Besides a vaccination, countries should strengthen the swine trade procedure to prevent the exchange of genetic material between swine through recombination and mobile genetic elements. Besides prevention from the swine or swine producers' perspective, prevention from consumers' perspective also plays a huge role. In an absence of vaccination, public health intervention, including a food safety campaign, would increase awareness of the disease and how to prevent it, especially within a community where there is a huge correlation between raw pork consumption and traditional culture. That's it from me. Next one is going to be explained by my colleague. Thank you.
My name is Edsal Sultan Pratama with student number 104. The conclusion of our project are Streptococcus suis is an anaerobic gram-positive bacterium, and the pathogen are at respiratory until alimentary tract. Meningitis is a common symptom in person, and hearing loss becomes its common complication. Sudden deafness caused by meningitis complication can be damage the cranial nerves and invades either cerebrospinal fluid or the blood. Then, etiology of the sudden deafness caused by several risk factors, including comorbidities and viral infection. The main examination that can be done are culture for identifying the bacteria and audiogram tests for looking the hearing function impairment. Then, it can be helped by CT scan or MRI for looking the inflammation sites. Treatment that can be given are penicillin combined with another antibiotics. Deafness in patient should immediately receive hearing and vestibular rehabilitation to increase its function. Could use dexamethasone for supporting its recovery. Streptococcus suis mortality rate has been generally low, but this bacteria has ability to disseminate by hematogenous spreading, cause various complications and systemic illness on improper treatment. In addition, besides vaccination strategies, another early prevention that can be done is to reduce the direct transmission by Streptococcus suis in community, and public health intervention, including food safety campaigns, can become main media to increase public awareness about its transmission. That's all from us. Thank you for your attention.
So that is it for our presentation. I hope all of you enjoyed. Thank you for listening, and I would like to close this video with Paramasanti. Om Santi 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 Om.